must tell you, Faith, in the last, I mean, we've been ahead of the world for a long time.
Yeah.
But in the last 4 years, I mean, we have just developed so much more in this country that we are streets ahead of the rest of the world. We get patients from all over the world coming to see us for their headaches because they just don't have the treatments overseas that we've developed here. And there are probably 4 milestones I can talk about. The first one was in 2012. I was involved in a debate in Vienna at the International Headache Society with Professor Jess Olesen. Now, he's head of the international committee that advises doctors how to diagnose migraine.
Actually, on that note, how do we diagnose a migraine? Because I'm thinking people feel pain and that's it, but how do you diagnose it?
Well, we have to find out where the pain is coming from. So we've developed diagnostic techniques at the headache clinic to find exactly where the pain is. But it's quite an involved subject, and I don't think we have time now.
Yeah.
But anyway, getting back to this debate with Professor Olesen, who's head of the committee that decides on how to diagnose, I was debating with him about their diagnostic criteria, and I proved to them that the criteria they use are absolute nonsense. They're baseless. And I actually won the debate against Professor Olesen in front of his colleagues. So it was a great victory. Then the second thing was also in 2012, I published a paper in the American Journal of Maxillofacial Surgery on a new surgical technique that we developed here for treating a condition called cluster headache.
We actually want to go into the issue of cluster headaches,
we'll
but before we go into before we actually go into it, Doctor, it appears as though we, as you were rightfully saying, we're quite ahead of the rest of the world, especially when it comes to diagnosing migraines.
Absolutely.
But in regards to the causes thereof, many individuals may say that as a result of me not wearing spectacles, let's say that I've got a poor eyesight or I'm short-sighted, etc., and I don't actually wear spectacles, I get migraines. What are those causes? Is that also part of the cause?
No, you've got to differentiate between what triggers it off and what the underlying cause is. And the best way I can think of to describe it is if you put a landmine under the ground and you arm the detonator, anything standing on it will trigger it off. So those are the triggers.
The issue of the glasses or the short-sightedness is just a trigger.
If you take the detonator out of the landmine, an elephant can stand on it, it won't explode. So what we do at the headache clinic is we find the patient's detonator.
So what are the detonators, though, in many of the patients?
Muscle tension and pain from the arteries in the scalp. And it's very important that people understand that it's not inside the brain. So any surgical procedure that we do, for instance, for the arteries, is on the outside, and it's very safe.
Sure. So then in that regard, when we're looking at being able to treat those detonators, is it preventative, first of all? Can I prevent a migraine from actually happening? How do I do so?
Well, by the right treatment. You can't do it. We have to do it.
So then would I get a headache and then I come to you guys and I say,
we find where the pain is.
Headache.
We find where the pain's coming from, treat that structure, and then, unfortunately, we can't, it's not a silver bullet. We can't cure people, but we can prevent most people's headaches from happening again. And that goes for migraine, and that goes for cluster headache, and that also goes for, and that's the third thing. Last year I published a paper on a condition called hemiplegic migraine, where the patient actually, when they get their migraine, they have it's like a stroke. They become paralyzed.
And how do you treat something like that then, doctor?
Those are treated by arterial surgery, by closing the arteries that are causing the problem. But as I said, not in the brain, on the outside.
Yeah.
And that was the third milestone. And then this year, it was very, very exciting. A professor of neurology from Harvard University, Professor Julius Spearings, and a professor of neurosurgery from Erasmus University in Holland, came out and spent a week with me to see what we are doing here that is so exciting, and they were knocked out.
And then on that notion, though, when it comes to issues, I mean, you keep mentioning cluster headaches.
Yes.
What's a cluster headaches, and what are the different forms of headache disorders? Because we understand that they're also headache disorders.
Yeah, look, all these different headache disorders, they run into each other. There's no hard and fast boundary between the two. A cluster headache is the very worst pain known to mankind. It's also called suicide headache.
Suicide headache.
Because people with cluster do commit suicide. They cannot stand the pain. But now we can do something about it. So we're getting cluster headache patients coming from all over for treatment, and when they go home, most of them don't have their clusters anymore.
Sure. So basically, we can help people. It's just that when you've got a headache, you've got pain, make sure that you get yourself to the clinic and you'll be able to be helped. Doctor, thank you so much for joining us this morning. We have to leave our conversation there because we're speaking to Dr. Elliot Shevel from the Headache Clinic, joining us and telling us more about migraines as well as the fact that you can cure it. We've got help for you. Make sure that you visit your clinic.